Welcome once again to the Sage. And thank you, as usual, for being with us. Last week, we had a very, very interesting, informative, and stimulating, in fact, a formidable lady on our show. We had Professor Echendu Dolly Adinma, a professor of community medicine and public health from Nnamdi Azikiwe University Hospital. And she had talked passionately from the perspective of what education, the strategic role of education in nation building. Last week, she shared with us the many things as a professor of medicine, particularly of community medicine, she had had the privilege of doing in terms of public health and community work, which have significantly impacted this country in terms of nation building, in terms of health of communities. She had also discussed her privileged role in training undergraduate and postgraduate doctors and contributing significantly to the development and turning out of these qualified and critical health personnel. Obviously, contributing again to this important topic, our important topic of nation building. We're continuing this exciting discussion with Professor Adinma, and she will go on this time round to again explore in further depth this issue. She will go on to discuss the strategic importance of research, as well as candidly share her own mind and thought about the state of our education system, particularly our tertiary education system in this country. Stay back. We're diving into research with Professor Adinma. Be with us. You will enjoy yourself. So we've listened with rapt attention. You've described the many wonderful achievements. And yet we know it's not been easy. It's never easy, particularly in our country, Nigeria. And so I'm going to ask you, you are a physician, very much a part of the health system. You're a teacher, a lecturer. And these two systems, health and education, we're also very much aware are one of the weakest, have some of the greatest problems in this country. What do you think are the weaknesses that still exist? With a view to, perhaps suggesting we need to improve, what we need to do to improve.
Actually, we need to improve. And in fact, it's long overdue for us. Apart from conducting researches and publishing, we've been able to use our findings as evidence-based data to influence policies.
Okay, I'm interested in that.
Yeah.
Because I tend to feel that sometimes academics tend to write it in the language of academia, write it in the journals, but translating research into policy action is so important. Perhaps, yeah. So let's hear about that.
In one of my researches, the one I must say I love very much, on community healthcare financing, we did a baseline survey on health insurance scheme, especially community-based health insurance scheme. We had model health centers that we used in Anambra State. And then, several years ago, when Professor Lambo was the Minister of Health, we had established, based on my research findings, on how community-based insurance scheme can run.
Okay, interesting.
So we mounted that, we used Anambra State as a pilot study. Lo and behold, the federal government came and took that model and replicated some other states in Nigeria.
Wow, that is a wonderful achievement. Well done.
Thank you.
Yeah.
So I'm very proud of that. In the areas of reproductive health, um, part of my research also took me to the National Council for Women's Society. And the then president of the National Council for Women's Societies, Dr. Gloria, she now made me the head of the Committee on Health for the National Council for Women's Society in Nigeria.
Okay.
It was quite revealing to me that the little works I've been doing in reproductive health could also catapult me to the National Council for Women's Society. Along the way also, the Federal Ministry of Health recognized me, recognized my work in reproductive health issues, and made me a member of the technical working group. And I've been in that technical working group since 2011 till date. Yeah. And we've been able to, the technical team and some other partners like WHO, they've helped in formulating the guideline on management of STIs in Nigeria.
Okay.
We had the first document in 2016, I think, and we are just about, in fact, we just concluded the revised edition a few months ago. That has helped me to contribute to the Federal Ministry of Health documents on management of sexually transmitted infections in Nigeria. I think I am the only public health physician in that technical working group. Others are drawn from microbiology, essentially obstetrics and gynecology. So that's another area of fulfillment to my journey of being a medical doctor and a lecturer in the university.
Yeah, and a perfect example of the fact that being a lecturer, a researcher, your work has been impactful.
Yeah.
It has indeed translated into action in some of the important health areas, policies and programs of this country.
Exactly.
So that is great. It couldn't be a better illustration of the importance of education, because when we do it well, when we do it with passion, when we produce good results, it builds our nation.
Yeah.
And so I will go on and take you by surprise and ask you, yes, you've talked about your achievements, but it couldn't all have been easy. We all know what we all tend to think about both your roles, careers in this country. What we think about the situation of the health in this country, and what we think about the situation of the teaching in this country. And I'm going to ask you, what do you think are the problems as well that continue to exist, with a view to perhaps suggesting what we can do to do better? So perhaps you want to start with the issue of health. What do you think are the negatives, the problems that continue to exist, which as a country we need to tackle?
The problems in health, so many of them. Where will we start? Is it on the part of the infrastructure, materials in most of our health facilities, health education in general in Nigeria, especially at the tertiary level? We've not really gotten it right. You look at all the resources needed to train this manpower. Is it the infrastructure in terms of materials? Is it the money that is pumped into these two systems? Money, material, and the manpower itself. Let me start by addressing the issue of problems with manpower. Both the teachers and the students. Have we gotten it right? I'll say no. For the trainees, students at the undergraduate level, because of policy issues in Nigeria, I don't think we are getting it right. Take the question of admission into our tertiary institutions. Are we getting the right persons to come in to train? I'll give you an example in the medical school. With this current system we have in Nigeria, you have the quota system, you have those that are coming in on merit, especially in the area of quota system. I think it's a drawback to us because we need to accommodate based on the federal character. You can imagine somebody from a particular state coming into medical school with a score of 300 plus. Because you want to accommodate the educationally disadvantaged regions, we are taking people who are scoring less than 200.
And so that is the quality of students you're now getting.
Exactly.
Lowering the quality a lot.
How can somebody who has less than 200 compete favorably in the classroom to qualify, say, as a medical doctor, a candidate that has come in with 300 and above marks? So in terms of policy, I don't think we are getting it quite right. You also look at the curriculum, very old curriculum that we are still using, giving students courses that are not really quite relevant to where they will practice eventually. I tell you what, I conducted a small focus discussion with students from a particular tertiary institution. They said they are giving courses that are not relevant to what they will practice eventually. They are reading long hours. They are in the medical school for several years. You can stay in the medical school, basically it's supposed to be 6 years. But because of strike actions, industrial actions in our university, these children are in the university for upwards of 7 to 10 years, doing some courses that are not relevant to them, not progressing at the pace they should be progressing to get out of the university. These are policy issues. Now, you take the issue of the trainers. Have you given them the enabling environment to teach these students? Most lecturers, even professors in the university, do not have offices.
Wow.
They share
Truly?
offices. So, what kind of enabling environment are you giving such teachers? Some people say universities are not supposed to close. You don't have a closing time for universities, and that should be the case. You don't say because 4 p.m. close of work, you carry a bag. That might be the time you will be in the lab doing some researches. If you don't have a good office to stay and you don't have the laboratory facilities to work with, what kind of a teacher will you be, and what kind of knowledge will you impact to the students? So when we hear the Academic Staff Union of Universities go on strike, people who are not there are not feeling the pains the ASU members are going through. You recall last year, ASU was on strike for almost like 8 years. 8 months rather. Yeah. From February up to November of last year. And you expect them to cope with their families, and it was no work, no payments. So such people we were not receiving, I wouldn't say such people because I'm also involved. We're not receiving salaries. What kind of a teacher will you be? And that will also impact on the way the teachers carry themselves. You hear of people sorting out when they take exams, students take exams, they sort out themselves. Sorting out means parting with some money or party, you pay in cash or in kind,
That is terrible.
especially the female fools. You are asked to bring some money or you are sexually harassed. So this is the system where we have found ourselves, where things are not going right and people try to cut corners. So that's for the manpower resources, and I've touched a little bit on the material. We don't have an enabling environment to work. One should be encouraged to have a comfortable office to work with, to have enough classrooms to teach our students. You see students staying on the corridor and the window, listening to a lecturer who is not even using public address system, just to fulfill righteousness. They come around to sign attendance because that will inform the eligibility. If you don't make like 70% of attendance to classroom, you will not write exams. So it's pretty a difficult situation for most institutions in Nigeria, where we don't have the enabling environment to work, where industrial actions talk of the day. Then financing of our health system, our educational system. I'm not sure we've also gotten it right. You see most vice chancellors of universities, chief medical directors of teaching hospitals, where our medical students practice. Most of them spend their time here in Abuja, trying to see and ensure that their budget will pass through. Each month they are running to Abuja to be sure the salaries are released. So it's quite a difficult situation. Currently, some workers in the university, not only in the university, even in the tertiary institutions, are being owed upwards of 2 years in a federal institution. Simple reason being that they have not been captured in the IPPS payroll.
In the payroll system
In the
of
payroll
the government.
system of the government. You talked about the center where I work. I have about 10 workers, 10 staff who were employed 2 years ago. They have not received a salary since then. And some of them, what can you do? There's no way you can control them. So this system is really in a chaotic situation. And I pray the government is listening to me. We need to improve our educational system in terms of the financial resources, in terms of the enabling environment, in terms of the quality of students we admit in our universities. It's really a pitiable situation. That's just a tip of the iceberg of what I can say.
Wow. And you call that a tip of the iceberg.
Exactly.
I was open-mouthed listening to you. I mean, we suspected it. We all know that these are perhaps two of the weakest systems or sectors in this country. And it's so tragic because, as we have beautifully demonstrated, that where it is doing well, where we do well, I think, let me start by saying that we agree that education is critical for anything, really.
Exactly.
No nation can expect to progress if it doesn't have its education right.
Yeah.
Everything you do in a country is through an instruction, through teaching, and therefore the teaching methodologies have to be right. Of course, health is wealth, so also providing proper health care is so important. So it was exciting to listen to at least the achievement you were able to describe, but also heartbreaking to listen to the many, many deficiencies that continue to exist in this country, which need urgent attention, which we can never emphasize too much. And so I think we need to schedule another program just in discussing the problems, Why? Because it's important that these problems be solved if we truly want to advance and move on. But be that as it may, before we have to regrettably close this wonderful interview, let me say to you, as the committed and formidable doctor and lecturer that you are, what are your last words to our audience, to the many young people who are watching, but also to the rest of us, oldies, mommies, daddies, grandparents, about this particular topic? What would be your takeaway words to them?
Nation building, education. We cannot do away without education to have a formidable critical mass of human capital in our nation. For me, and as I have said, if we don't have this critical mass of individuals in Nigeria who are well educated, we won't get it right. Soup without salt. And I will urge our governments, private individuals who can really assist in building our education system, our health system, to please come to the rescue of Nigeria. It's gotten to a critical stage which I can describe as a disaster. More importantly, now that even the few that we are educating are checking out, running outside to other countries of the world. Can we look at the push and pull factors that are making our youths to migrate abroad? I would say we are only training for exports nowadays. Parents commit a lot of resources in training their children, but these children are leaving us and we don't know when they are coming back. And that will, in the near future, impact on our demographic status of this country. The young ones, the brilliant ones that we have trained here are leaving us, or you spend so much money in foreign currency to train your works abroad, and they're not coming back to the country. Who would then take over from us? I think my own generation, maybe the only people remaining here. Others are the Jackpot syndrome. So can we take a break and look, what are the push-pull factors that are making our people leave? In the health sector, medical tourism, we thought we were going to reverse it, but we are not able to reverse it. We are still spending our hard-earned economic resource from this country for people to go abroad and get treated. And you know, when they go abroad, they even meet Nigerians, blacks. So why can't we find a way of keeping people to stay here in Nigeria for us to develop Nigeria? Nigeria is a beautiful country. You travel abroad, you feel like coming back home. Home is home. So get our youth back to the country and provide us security. Security is quite important. Can we be assured of our security? Can we be assured of quality education, healthcare for all citizenry? That is my take for all of us. Thank you so very much for inviting me.
Beautiful, beautiful. I had forgotten actually that I was supposed to be the interviewer. I was listening with rapt attention. There couldn't be a better closure really than that. While we're all agreed, it seems obvious that education is a very, very critical and important part of nation building. But we also must be truthful and admit that there are many, many problems with our educational system in this country. I think we will look at having more in-depth discussion on the weaknesses that continue to exist and therefore threaten our educational system. Particularly for us on the Sage, our focus is many times on young people. And I think I don't think, that this issue of the poorness and weakness in our educational system impacts them most. But I was particularly struck by the statement from our guest about the fact that when we struggle and train, the best of them leave because of the circumstances that continue to exist. We all have a responsibility in our nation building. And it is obvious from this discussion that one of the places we must urgently focus and address is the issue of our education and the issue of the health of the people of this country. Thank you so much for being with us. Let's, even as we on set and to you, our audience, say, let us all think about what we need to do to make the important difference that needs to be made in this area so that we can indeed make our country great as it should be. We thank you. See you next week.